If they're unsure, they put you on drugs, and that's just not the approach. Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. Today we have Jan here who has been through the ringer. He has costochondritis. So if you have costochondritis, you're going to want to watch this because he also thought he was having a heart condition. He went to the emergency room, right?
Yes.
Yes, more than once, correct?
Only once.
Once, okay. So he went to the emergency room thinking he had a heart condition, and they've run through all the tests for him. And, he last went to the electrophysiologist, right?
Yeah.
And he went in there and he had a little bit of a costochondritis flare-up, a little bit of a sensitivity in the chest, which then triggers the vagus nerve, which can raise your heart rate. So it controls your heart rate. So that raised, and the doctor saw that. What did he do? He put him on a blood thinner. So he's a young guy, doesn't need to be on a blood thinner, and your heart rate goes up. I mean, sometimes it goes up, sometimes it goes down. You know, you need to monitor it on yourself. You need to be your own advocate. Cardiologists will put you on a slew of drugs, a slew of medications, even if you don't need it. They're covering their butt. God forbid you do have a heart condition, right? But all his other tests were negative. Stress test, EKG, right? All negative? Mm-hmm. Yeah. So he does not have a heart condition, yet they put him on blood thinners because his pulse was high. So we just checked his pulse, and you can check your pulse with a simple watch, smartwatches, and they're effective, they work. So check your pulse on your own throughout the day, make sure it's normal, and then when you have a costochondritis flare-up or a chest pain flare-up, check it again, and it's probably going to go up, and that's okay. Doesn't mean you need to be on medication for it. So this is my frustration here with cardiologists. They're awful at diagnosing something that's not the heart. If they're unsure, they put you on drugs, and that's just not the approach. A lot of them have no clue what costochondritis is. If you ask them, they have no idea. They're cardiologists, they're heart doctors. They are not chest wall doctors. They're not joint rib doctors. So they just don't know what costochondritis is. Most of them don't, okay? And we could do a survey. Maybe we should. But so he even said that his heart rate goes up when he lays on his back. And his chest pain starts to flare up, and then the heart rate goes up. So in certain positions, he feels it more than others. He feels his heartbeat more than others. That just tells you, screams costochondritis. So we've been working with him. We're on visit three? Or four? Four. Yeah. And he's had, for the most part, not much chest pain, right? A little bit yesterday?
Yesterday was just a little bit.
So just yesterday, in the last week or so since we've been seeing him, he's going to get through this, and his heart rate will start to normalize, and even a chiropractic adjustment can lower your blood pressure. So they've done studies on that, but we're not trying to lower his blood pressure here, okay? We're just trying to reduce the inflammation in the chest wall where the ribs meet the cartilage, and then also here in the thoracic spine. He's got a little bit of a curve here. The spine shifts a little bit to the side. So we're going to correct that, because where do the ribs go to? Not only into the chest, they attach and wrap around into the spine. So you have to address the spine, the posture. Take a deep breath in and blow out. And my guess is yesterday you started feeling some pain because you just haven't held your adjustment for more than a few days at a time. And that's normal in the beginning. Deep breath in again. And blow out. Good. So what we did was we gave him some heat here, and then we put ice on his chest at the same time. And again, deep breath in. And blow all the way out. Good. So this can be really frustrating for people I recommend that if all your tests are negative, cardiovascular tests, you just have high pulse, check it on your own with a smartwatch, but also get second opinions. You know, if they try to put you on medication and they don't really know what's going on, and because he's not getting a clear answer really from them. And a blood thinner is his answer to high pulse just once when he was in the office. There's something called white coat syndrome. Google it. For you folks, I'll explain it. It's basically someone that gets nervous to have their blood pressure, their pulse taken while they're in the doctor's office. So it automatically raises to a level that's higher than what it should be. But if they were to go home and do it themselves, nice and calm, in a resting state, it would be a different story. Take a deep breath in. Good, and blow all the way out. Good. So he was also, not only did it come in with chest pain and costochondritis, but also had some shoulder pain as well. We're going to check his shoulder right now. Go ahead and turn over on your back. Now, do you feel the heart rate going up when you're laying here on your back?
No.
Okay. And do you normally feel it when you lay on your back?
Yes, whenever I have the chest pressure.
Okay. Do you have any chest pressure right now? You shouldn't after I just adjusted you.
I did not. Even since this morning, I did not have.
Okay. Relax here. And we've given him some exercises to do at home as well. Any questions about those?
No. I just need to know which exercises that I need to do.
I'm going to show you a few new ones here today.
Sure.
And relax yourself here. Okay. Now we're going to check the shoulders. So arms out. And resist me. I'm going to push down, hold. Good. Any pain there?
No.
Okay. Relax this arm. And make a fist like this. Yep. I'm going to push down, resist. Good. Any pain there?
No.
Same thing with this one. Make a fist, bicep, yep, and resist. Any pain there?
No.
Okay. Palm out. And hold. Hold. Good. And the other side. And hold. Hold. Good. Now we're going to check the ribs. So I want you to make a fist. Punch up to the sky. I'm going to push down a little bit here. Just relax your arm. Okay, now I'm going to push down and resist me. 1, 2, 3, resist. Okay, and this one. Punch up. Bring it halfway back. Keep that arm locked. And resist. Okay, and relax. So you get some tenderness on the left side?
Mostly on this side, yeah.
Mm-hmm. Okay, so we're going to pull the shirt up and we're going to laser over this spot here.
Also feel something on my chest on the right side a little bit.
On the right side? Okay, we're going to laser the costochondral area where the rib meets the cartilage. Give me 1 second here. Okay, so now we're going to use cold laser therapy to reduce any inflammation in the chest wall where the cartilage meets the rib. Okay. And this just takes a few minutes. Now, this is sort of an extra here. The cold laser really helps to reduce the inflammation much, much faster and get people through this awful condition, costochondritis. This just helps to reduce that inflammation so much faster, 40 to 50% faster. So we're just going to speed this process up for him so he can get off those blood thinners, which he most likely doesn't need. And that's it, folks. We just do this for a few minutes, and then he's all set. You're going to hold that there. Thanks for tuning in. And if you have any questions or comments, make sure you comment below. Thanks.